Medicare's been actually doing some things to help family caregivers. One of the things is the guide model that Keith mentioned. From day one, there was actually support for family caregivers as part of that model. Respite care, education, training, things like that were part of the guide model from day one, and that was something that ARP advocated for as well. In Medicare now, started January 1, 2024, Medicare covers caregiver training services. It pays healthcare professionals solely and specifically to actually train family caregivers in things like daily activities, like if you're trying to help someone bathe and how do you safely transfer, move someone from like chair to bed, vice versa, sort of eating, daily activities, behavior management and modification training, like if you're helping someone with Alzheimer's or someone who has some mental health challenges, for example. And Medicare recently proposed to make these services available via telehealth next year. That's not final yet, but that could help expand access for caregivers who might not be able to be as easily in person to get these training services. Medicare also proposed to expand these caregiver training services to pay healthcare providers to train family caregivers in more of the medical nursing tasks kinds of things. So if you need help with infection control or wound care or other different things like that, Medicare would help pay healthcare professionals to show you how to do that. There is absolutely more that Medicare can do as well, and we've been advocating with the Centers for Medicare and Medicaid Services, which administers Medicare, to help support family caregivers in some of the ways I just talked about. Also at discharge, like when you're coming home from the hospital and things like that. Better identifying family caregivers, making sure that they're appropriately included in care, that you're looking at their care experiences. So there's a number of things that Medicare can do. Those are some administrative things that can be done without an act of Congress, but we're also advocating for things that Congress could do in the Medicare space. There's a bipartisan bill called the Alleviating Barriers for Caregivers Act, and that's about reducing red tape for family caregivers. We've heard talk about time and like the challenges of finding resources and navigating complex programs and paperwork and forms and red tape and all of that. This would have the Social Security Administration and Medicare and Medicaid look at how they could reduce red tape for family caregivers, looking at forms and processes and procedures and all of those kinds of things, and seeing where are there opportunities to make it easier for family caregivers to help their loved ones. And then there's another bill called the Connecting Caregivers to Medicare Act, because you might have heard of 1-800-Medicare. If you've had Medicare, you can call that. It's a 24/7 hotline to get information. And sometimes family caregivers may be calling that if you're helping someone with Medicare. But there's actually, if you have Medicare, you can fill out a form if you have Medicare to give 1-800-Medicare permission to share your health information with a family caregiver or someone you designate, so that if that family caregiver is calling 1-800-Medicare and advocating on your behalf or trying to help you figure out appeals or benefits or coverage or whatever it may be, that it makes it easier for them to talk to 1-800-Medicare. That's a choice, and people can make that one way or the other. But that bill would help make sure that more people are aware of that option, so that they know, and it can be easier potentially for family caregivers to help navigate Medicare on behalf of their loved one and support them. So those are some things in the Medicare space, but Medicare is really important because other people look to what Medicare does and sometimes follow what Medicare does. So that's an area that we've been focusing on a lot because it serves a lot of people, and a lot of people on Medicare have family caregivers.
So Rhonda, is there a difference between all of that, the improvements in Medicare, and then what's happening in Medicare Advantage?
In Medicare Advantage, there are some there are policies in Medicare Advantage. Sometimes there are what's called supplemental benefits, and plans can offer certain benefits that might help support family caregivers, like respite or some home care options and things like that. In Medicare Advantage, plans can change benefits and things like that each year, and they decide what they offer and who is eligible and things like that. So there are ways to support family caregivers in Medicare Advantage as well. Those can change from year to year and whatnot as well. And it's important to support family caregivers across people with Medicare, whether you're in traditional Medicare, whether you're in Medicare Advantage, regardless, caregivers need support in general. So we need to make sure that there's policies in place in Medicare, in Medicaid, broadly to support family caregivers, full stop.